And Mohawk Valley Health System held a press briefing this morning to update the public on the status of healthcare delivery within their system in light of the COVID vaccination mandate taking effect. Darlene Stromstead, President and CEO of MVHS, took advantage of the gathering to first stress the importance of everyone becoming familiar with the warning signs of heart attack and stroke, and imploring people to not wait to seek help if they feel that there is a situation where it may be warranted. As for the situation of the vaccination mandate and delivery of health care, Stromstead said that the hospital system has seen an increase in staff vaccinations since the deadline for religious accommodations expired yesterday. But there is still a significant number of employees who have not yet been vaccinated.
This last Monday, when the religious accommodation was eliminated as an option for healthcare employees, we had about 200 employees that were covered under the religious accommodation. Since then, we have had several more come forward to get vaccinated, but we are still seeing an unvaccinated rate, and it changes every day, of more than 100, plus the other 75 that we lost earlier this fall. So we are struggling with a high vacancy rate of employees. It's similar to what hospitals all over the country are dealing with.
Stromstead stressed that some of the nursing staff deficiencies are being covered by hiring traveling nurses, but noted that the 6-week price tag for that is just under $2 million. As much as a third of the nurses who are on the sidelines have retired. And while Stromstead noted that MVHS has avoided going on diversion, a move that would restrict access to the hospital's emergency rooms, the staffing situation will have an impact.
There are a few services where we are decreasing accessibility. We are limiting some of our elective surgeries 10 to 15%, about 10 to 15%, so we're still doing most of the things, but we are decreasing that. For inpatient surgeries that are scheduled, we will schedule you and do the surgery only when we know there is a bed available. So if we don't have open beds in the hospital, your surgeries might get delayed for a few days, as long as they're not emergent. And this is, if you have an emergency need, that will be taken care of, but some of the electives might get postponed.
Stromstead said that under these situations, it can't be business as usual, but MVHS remains committed to providing services to the community.